Hi, how are you? Today I'm going to be doing a medication administration video.
Come in.
Hi, how are you? My name is Diana. I'm going to be your nurse today. Can you give me your date of birth and your name?
Jane Doe, 010188.
Okay, perfect. I'll be administering your medications at 8 a.m. I see that I want to check on a little things before I give you the medications. Are you allergic to anything?
No, no allergy.
Um, so right now it says this is the normal medication that you take at home. That's correct.
Yep.
Normally, at what time you take your medications at home?
10 a.m.
Okay, and then I'm gonna check with you every single medication, just to make sure that is the right dosage. Is
Okay.
that okay? And then so we check we verify the patient, we verify the time, we also verify your that is the right route. So I'm gonna all the medications that you take are oral, correct?
Yep.
Okay, so your first medication is atenolol. It's 25 milligrams. It's right now 10 o'clock. You told me that you normally take your medication at 10 o'clock?
Yep.
Okay, perfect. So this medication, before I give it to you, what I'm gonna do is I'm gonna take your blood pressure and I'm gonna actually take his heart rate at the applicable pulse. I'm gonna try to get it for a minute so that way I know exactly how his pulse is reacting. I cannot provide this medication if the blood pressure is too low or the heart rate is too low, lower than 60. So it has to be greater than 60 in order for me to give the medication. So before I give you this medication, I want to tell you some side effects or reactions that you could have to the medication. If you notice that you feel fatigue, dizziness, blurry vision, or you feel like a regular heart rate, like that your heart rate is a little slower,
Okay.
then let us know, because those could be adverse reactions that you will have to the medication.
Okay.
Okay? Normally, this medication helps you out for your blood pressure, and then especially when you have a high pulse, so that way it stabilizes your pulse.
Okay.
All right? So, Jan Doe, date of birth 01/01/1988.
Okay.
I'm giving you this medication, which is atenolol, 25 milligrams, oral at 10 a.m.
Okay.
Okay? I'm going to document what you're taking. So the next medication is atorvastatin. This one is for your high cholesterol and your hyperlipidemia. So what it's gonna do, this medication, normally the effects are to lower your LD cholesterol and your triglycerides. It also has a reduction of the lipids cholesterol on your blood. Normally, have you been taking this medication for a long time?
Yes.
I would recommend you to actually do a blood work, just to make sure that because normally this medication normally metabolizes or processes in the liver. Therefore, you want to know how your liver is functioning. Okay.
Okay.
All right. So if you have any precautions that we have to have, it will be hypersensitivity, and then also the active liver disease, which I already explained to the patient. Sometimes this medication could give you some side effects. Some of those side effects are dizziness. You might feel some dizziness, or you start getting yellowish, because that means that the liver is not working pretty well. So that's jaundice. You also have any like muscle pain, muscle soreness, that also will let us know that you have and then you'll also have some hypersensitivity reactions, in which your skin feels like a little sensitive, or anything will make you sensitive.
Okay.
All right, I'm gonna give you atorvastatin, 10 milligrams. It is 10 o'clock, and you're gonna take it orally, and then your name is Jan Doe, 01/01/1988, correct?
Yeah.
All right, let me document. So we just finished with your home medications. I know you mentioned that you have a little bit of mild headache. I see here on your documentation that you have Tylenol as needed. Do you want to take a Tylenol now?
Yes, please. I have a headache.
Okay, so I have here that you have a 650 milligrams.
Yes.
You want to take the higher dosage? That's fine with you?
Yeah, that's fine.
Okay, so I'm gonna ask you several questions. Normally, you want to check on the history of the patient if they have an alcoholic problem, as this medication also processes on the liver. Therefore, it metabolizes in the liver. It also the person could also have issues with the liver enzymes. Therefore, you want to make sure that the person alcohol, if they take, if he's an alcoholic. Also, you want to also check on the type of medications, or if they abuse medications, or if they are, abuse any medications for pain. So we also want to check on that, because sometimes they might don't work, or they might cause other side effects. So after you check on the history, you also want to check with the patient. Do you drink alcohol?
No.
No?
Mm.
Not even socially?
Socially once, or twice a year.
Okay, perfect. Sounds good. So what I'm going to do is I'm going to prepare your medication now, so that way I'll bring it back to you. And we'll check to see how your pain is from 0 to 10 right now.
Right now I have a headache like a 4.
A 4? Okay, perfect. And then I see that he doesn't present any fevers. Tylenol is also used for fevers, but he's not presenting any fevers. So this is an analgesic. I already checked on his labs, and his liver enzymes were okay. Therefore, we're good to go, and then that's the reason why the order is there too. We just want to verify it and make sure that obviously his liver enzymes are good in order for him to take the medication, so that way he doesn't have a hepatotoxicity. That means that your liver has a higher concentration of enzymes. So this is Tylenol, which is acetaminophen, 625 milligrams.
650.
650. Let me check, please. Hold on. Correct. So this is acetaminophen, 650 milligrams. You're gonna take it orally. Your name is Jen Doe, and your date of birth is 01/01/1988. And then the time right now is 10:15. Okay.
Right.
And then I will document the information. I will document all the documentations. So I promoted the 6 rights of medication, which are the right patient. I checked it with every single medication. I also check the time, which we make sure that every time that you give the medication, you put the time. It cannot be 1 hour after. It has to be between 1 hour after and 1 hour before. So it has to stay within the therapeutic timing. Also, we want to check that is the right the date of birth, or which is how we would check the name and the patient, and the patient day and the patient date of birth will make us sure that that is the right patient. We also want to make sure that is the right route. So in this time he took everything PO, therefore everything was by mouth. And we have the right of administration, and the dosage was documented. So in the documentation, we make sure that we put the dosage and all the other rights that I just mentioned before. And then that will be the right of documentation. All right. Thank you so much. And this is my video for medication administration.